Healthcare professionals are on the front line of the COVID-19 pandemic and place their lives at risk to protect us from this disease. These physicians, nurses, and other healthcare professionals are at high risk for exposure to the virus which causes COVID-19, and if infected, are effectively taken out of the fight against this killer. To date, over 1,000 healthcare professionals worldwide have died from COVID-19, with over 20% of positive tests coming from healthcare professionals. This loss of our healthcare professionals is one of the single biggest threats to controlling this and future pandemics. The conventional stethoscope is an essential tool for healthcare professionals to diagnose and monitor patients with suspected or confirmed COVID-19. However, the use of a stethoscope requires close contact with these patients, increasing the risk of infection, even when the healthcare professional is wearing personal protective equipment or PPE. The process of suiting up in PPE before each patient examination and disposing of PPE after each examination is costly in both time and money. The chest and earpieces of current stethoscopes are vectors for patient-to-patient disease transmission, as disinfection practices are not uniformly practiced in busy healthcare environments. Disposable stethoscopes can prevent disease transmission between patients. However, these stethoscopes are known to provide poor audio quality and still require the patient to be within arm's reach. There is a critical need for new diagnostic tools to minimize the spread of infection, protect healthcare professionals, and improve their efficiency, all while allowing them to provide better care to patients. The Auscul-X touchless stethoscope system from Auscul Sciences is a remote electronic stethoscope which allows doctors and nurses to listen to the heart and lungs of a patient from a safe distance, up to 3 meters away from the bedside or even outside the patient's room. Developed by leading physicians, Auscul-X represents the next generation of patient auscultation. 6 bioacoustic sensors are placed on the patient's torso, 4 on the front and 2 on the back. Once placed, these sensors can remain on the patient for multiple days and allow healthcare professionals to auscultate on demand with audio quality as clear as a standard electronic stethoscope. The sensors are disposable, which reduces the risk of patient-to-patient transmission of disease. These bioacoustic sensors are connected to the control unit located up to 3 meters or 10 feet away from the patient's bedside. Doctors and nurses can plug their earbuds into the control unit and listen to the sounds of the patient's heart and lungs captured by any of the 6 sensors, adjusting the volume as necessary. A wireless capability allows doctors and nurses to auscultate the patient from outside the room, from their smartphones, tablets, and workstation computers. By removing the need to wear PPE to examine the patient's heart and lungs, healthcare organizations are expected to realize improvements in staff efficiency as well as lower PPE costs. Both the wired and wireless listening options offer the ability for multiple healthcare professionals to auscultate the patient simultaneously, both live or recorded, aiding in auscultation training and helping to ensure accurate patient information transfer during shift changes. The Auscul-X system also includes the ability for healthcare professionals to visualize and annotate recordings of heart and lung sounds and to share the audio, graphs, and notes with authorized team members. These server and cloud-based collaboration capabilities make Auscul-X ideal for telehealth operations, including use at remote clinics where staff with limited experience with auscultation can consult virtually with remote specialists. With Auscul-X, hospitals, clinics, and healthcare professionals will see the following benefits: improved workflow and reduced costs by reducing the number of times healthcare professionals don PPE. Improved patient safety by eliminating the stethoscope as a vector for patient-to-patient disease transmission. Improve patient management by allowing healthcare professionals to share audio and data with local or remote colleagues and to provide auscultation data during shift changes. And improve safety of healthcare professionals by increasing the distance between them and their patients during auscultation.